Hi there, my name is Dr. Douglas Kupas. I'm an emergency physician and EMS physician here at Geisinger Medical Center and Geisinger Health System. And really want to fill you in, I guess, primarily the thing that's drawing attention is the big white tent behind me. And that's drawn a lot of questions and drawn all of you here. And let me give you a few points about that. The primary reason for doing this is we are preparing for what we think is coming. I personally hope that we don't need this tent, but I think it's almost impossible that we're not going to need the tent. We think that there is going to be a significant number of patients that have some symptoms of coronavirus, and we want to be prepared. So there are a few things. First of all, we have an 800 number that we can give you. The 800 number is meant for anybody that is having symptoms but doesn't feel like they are seriously ill. We want them calling that number. They'll get guided through the proper thing to do. They might need to be best served by getting some care at their primary care office. They might be best served by getting care at another site. They may not necessarily need to come to the emergency department, so we want them to use the 800 number for things like that. So that's number one. Number two is if people are having medical emergencies, if you're having chest pain, if you're having stroke symptoms, if you've had some sort of trauma, we want you to come to our emergency departments. We are business as usual in the emergency departments for all of the other things that are going to continue to happen in society with healthcare, other than coronavirus also. So, we are prepared to take care of patients that have the run-of-the-mill heart attacks and strokes and that sort of thing. The next big thing I think is what's of real concern is the people that have symptoms of potential coronavirus. And that's why we're setting up the tents. At every one of our emergency departments, everybody is going to be screened before they go into the emergency department. And we ask the public to understand and sort of work with us on that. People might get some parts of their vital signs twice. You might get a temperature as you come into the screening, and then you might get another temperature when we actually bring you in and get your full set of vital signs. There's a purpose to that. I equated this sort of to going through TSA. If you go through TSA, you have to show your driver's license, you get a little credentialing, and you might get sent to the pre-check line, you might get sent to the regular line, but you get screened. We're going to screen at the entrance to every one of our emergency departments. So people will be asked some questions, and they'll have their temperature taken. This will be for patients that are coming in, but it also will be for all of the visitors that come in with a patient. There will be some specific visitation restrictions that will happen all through our facilities, but that's sort of a separate topic. But from the emergency department standpoint, a lot of people do come in with somebody that has to be with them to help them out through their visit. We understand that, but all of those people are going to be screened too, because we don't want one of them having a fever or symptoms and then spreading this to others in our waiting room or in the emergency department. So we'll screen the visitors, we'll screen the patients, and then the other thing is we're going to screen EMS. When EMS is bringing a patient in, they already have protocols to screen the patient, put a mask on them if they're bringing them in, call ahead so we can get a room. But as an added safety measure to that, EMS will be screened when they arrive to make sure their patients are properly masked if they need it and that sort of thing before they go in. So this is all really for the safety of the public that is within our emergency departments, visitors.